they're in pain. It just doesn't seem comfortable.
Exactly.
And you were motivated personally to study this, and help us understand that.
Well, my first birth, I have a more natural background, and my intention for my first birth was to have a very natural birth at home. And I had in my mind, and I think, you know, the general fear of a first-time mom, that this is going to be painful. And like you just said, you know, media, movies, everything really promotes that whole screaming birth. And I thought, no, I am going to have a very natural birth. I'm going to have it at home. I'm not going to have a medical intervention, and I'm going to fight this process that everybody says you know, you can't have this, you can't do this. And my birth was, it was a very fighting birth. It was a long warrior birth.
Okay.
It ended up the way I wanted it.
Yes.
But it was a very long, aggressive birth.
Okay.
And I realized after taking hypnobirthing and when I was pregnant with my second, that I had created that birth, that mentally I thought I had to fight birth, I had to fight this process. But when I realized and had been taught that you can have this calm, natural, relaxed birth, and the tools that are provided through hypnobirthing allowed that. It was incredible. My second birth was day and night.
It just makes sense that if we're fearful, we're in that fight and flight state where our muscles are all contracted, it seems counterproductive to delivery.
Yes, absolutely.
So if you were at the first birth that Lisa had, Jada,
that's a great question.
What would you have done to help support Lisa through this long warrior birth?
Yes. So if I happen to be at a birth and there's a lot of struggle happening and a lot of this kind of fighting against what's going on in the body, I usually do a little bit of counseling and coaching in between the contractions, and I would have said, you know, let's just relax your body as much as possible and allow the birth process to happen, and let's see if we can do that one contraction at a time. So I find that my role often is, you know, motivational coaching type of thing. So.
I think it's important that we, again, bring the men or the fathers back into the role. So we've got the doula, we've got the hypnobirthing coach. Where does the father fit in to the process of your teaching roles?
Well, at the birth, I involve the father as much as possible. And, you know, most of the births I've been to, we need at least 4 hands in order to support.
Okay.
You know, different positions. You know, if a woman is, you know, doing the slow dancing position with the partner, I'm often doing a lot of massage. Sometimes I'll do a bit of acupuncture. So, you know, it definitely takes 2.
Yes.
I find, to support. So
okay, so you're just helping bring the father
yes.
into the process.
Yeah.
And I know that with hypnobirthing, my husband and I, we both went down. At the time, there wasn't a practitioner in Ottawa, so I'm really happy to see that you're here. We went down to Toronto, and it was the whole weekend was devoted to the birthing process, learning how to relax. Is it really hypnosis?
It's not. It's really teaching you to really relax the body. And like you had said before, you know, that fight or flight, it's teaching your body to relax through the process, because when the muscles are really tight and tense, you're not providing the blood, the oxygen to the uterus muscle. So yes. When it's not there, then it tends to cause complications with the birthing process itself, and then medical interventions.
I found it very useful because I found that, you know, if we want to be good at anything, we have to practice. And after our coaching weekend, we were given tapes, we were given tools to actually start practicing. So by the time the birth actually came around, I had heard that tape over and over again, and my body just heard the tape, and I just automatically started relaxing.
Right.
Now, one of the things that is out there is it says it can get rid of pain. Is that true?
I think it's not, your focus isn't on pain. When you're so relaxed and the muscles are relaxed and full of oxygen and blood, there isn't pain. You're relaxed. I think fear is the cause of pain. And when you're properly taught about the birthing process and you're teaching your body how to relax, and you have confidence after, you know, you practice everything that you've been taught, then I don't see moms in pain. I see moms completely relaxed, completely enjoying the birthing process and allowing their body to enjoy it as well.
So last tips, Jada, as a naturopathic doctor and a doula, what are your tips to our ladies who are out there thinking about being pregnant or who are pregnant?
I definitely recommend seeking some preventative help before, actually, like the 2 weeks before the labor, because there's a lot of natural therapies and remedies that can help support the body before labor begins. And I usually kind of recommend, my patients to go do a hypnobirthing class. So the biggest tip would be go in and speak to a naturopath.
Yes,
and,
so early.
Early.
Up to 6 months before.
Exactly, yes. Yeah.
Thank you. And Lisa, what would you recommend from your background?
For my background, I really recommend trying to get in to see a hypnobirthing practitioner as early as possible in the pregnancy, because it gives you time to really get to know your body, to practice, to have time to get rid of the fears and really appreciate the whole process and be excited. And
where can people find you?
Where can they find me? They can find me online on the hypnobirthing website or on my personal website, www.journeyintolife.ca.
Wonderful. And Jada, you're at the Healing House.
Yes.
.com or .ca?
.ca.
.ca Canada. That's wonderful. I could talk to you all day. But be sure and go see a professional like these ladies, because it will really change your birthing experience. So thank you for taking the time to be here.
Thank you.
I know that it was so helpful to have a midwife, a doula, and my journey with hypnobirthing to make my birth experience for myself and both my husband really, really helpful. So coming up next, which herbs should you avoid during pregnancy? Lots more information, and we also have a special guest who's actually new to Ottawa just recently in the spring. So stay with us and we'll be back very shortly. Welcome back to our show on pregnancy. Before the break, we were talking about various herbs. And when you're pregnant, it's very important to know which herbs to really think about avoiding. Some of the key herbs that you want to really pay attention to and always check with your healthcare team first is saw palmetto. That one, when used orally, has actually hormonal activity. Golden seal may actually cross the placenta, and herbs like dong quai, blue, and black cohosh, when used orally for women that are not at term, can actually cause uterine stimulations and contractions. Paw d'Arco and passion flower, when used in large doses, can be problematic, and pennyroyal can as well. On the flip side, which herbs are generally safe during pregnancy? Well, we've already spoken about ginger, oats and oatmeal. There's also red raspberry leaf, especially in the 2nd and 3rd trimester. And we have peppermint leaf, which can also be very gentle and helpful in nausea. Our final guest today are specialists in, one is a specialist in prenatal and pediatric chiropractic for over 8 years. Learning about trauma being done to the delicate spines of babies during birth is what ignited Dr. Nancy's passion about gentle childbirth. She's been supporting women through their pregnancies and births since 2001 as a childbirth educator and as a doula. She is a mom to 3 children, all born naturally at home, and her 3rd child was the first baby born at home live on the internet. We also have Dr. Jacqueline Smith, who's from the Ottawa Integrative Health Center, and she's going to help us learn more about supplements and foods. Welcome, ladies, and thanks so much for spending time with us today.
You're welcome.
So while you're nursing, we're going to start with Dr. Jacqueline. Dr. Jacqueline, what are the top 7 foods and supplements that a pregnant woman should be thinking about?
So we've already covered calcium in this program. We want to move on next to another one, which is folic acid. Many of us know about how it's going to prevent the risk of neural tube defects. One of the things that's come up, though, is sometimes people think more is better. No more than 1 milligram per day should be taken, because more than that has been shown now to increase the risk of asthma in the infant. So that's the most important thing. The second thing is that folic acid takes about 12 weeks to get to saturation levels in the body. You want to start 3 months before you conceive. But if you get caught off guard, which happens every now and then, you want to look for folic acid in the form of 5-methyl-tetrahydrofolate, MTHF. Okay. And that one there is rapidly absorbed and assimilated, and you'll get to that end result so much faster. So that's number 2 on the list.
Okay, number 2.
Number 3 is iron. In the 2nd trimester, blood volume doubles, and so it dilutes the amount of iron we have in our bodies. When we look at that, then you're going to be at risk for anemias, and in turn that can lead to low birth weight babies. That can lead to placental abruption, which is a tearing of the membranes, and in turn premature delivery. So there's a huge risk. Try to get increased iron from fortified whole grains like healthy cereals. You can also have a good source of iron in your red meats. If you have no risk of cardiovascular disease, once a week really isn't the end of the world, but also consider looking into healthier forms of red meat like bison. That's a really, really wonderful source.
I heard that it could be up to 40% leaner than beef, actually.
Absolutely.
Yeah, so that's
Absolutely.
a great option.
It's really wonderful. Now, if that's not enough, consider a supplement. A lot of women will find that a supplement will lead to digestive concerns. That's because it's not that absorbed. If you see a product that has about 300 milligrams of iron in it, only 10% of that is being absorbed. The rest sits in your digestive tract, in turn causing GI upset, gastrointestinal upset, or constipation. High quality products have about 25 to 35 milligrams per dose, are often combined with something acidic like a vitamin C to better absorb it, and in turn have other supportive blood builders like some B vitamins. So if you go to a high quality health food store, you'll find really great bioavailable products. Just make sure you take it 2 hours away from calcium to ensure its absorption.
Yeah, and again, this is a lot of information, so really what we want to do is encourage people to see a naturopath so that they can get a list.
Yes, please keep me in business.
Yeah. Okay, so we've got calcium, folic acid, we've got iron.
Yes.
What else?
Now we get into the fun stuff.
Yeah.
Raw onions and garlic.
Oh, okay.
Yeah, not really a crowd pleaser, but raw onions and garlic, only raw, are antimicrobial. So they're going to reduce the risk of infections, particularly group B strep, which is a major concern for septicemia in infants and newborns. In addition to that, they will prevent elevated cholesterol, mild gestational hypertension. So you have a real good reason to incorporate them into your diet.
Salads and just all kinds of things.
Salad dressings, yeah, toss them all in there.
Okay. Our last ones are?
So you mentioned red raspberry. That is one of my favorites. So raspberry leaf is what we call a partus prep. So that means that it gets the uterus ready for pregnancy, and what it'll do is prevent pre and post-term deliveries. It's going to reduce the need to have artificial rupturing of the membranes, vacuum or forceps births. It'll speed up the second phase of the labor, which is so important. That's when the baby actually descends into the birth canal, right through to the point where it's delivered. So we can reduce that from anywhere from 3 hours down to minutes. And last but not least, it helps the uterus to recover following the delivery, so you get back on track.
Tastes great.
Why not? Yeah. So one cup of raspberry leaf tea twice a day, or if you don't prefer the taste, you have the option of the supplement. 1.2 grams twice a day will do the trick.
Okay, wonderful. Thank you very much.
You're welcome.
So we're excited to have Dr. Nancy on the show, and we have Osiah here, who's awake now and full. So Dr. Nancy, you know, the whole experience about having the birth on live stream, it was a little bit controversial. Can you help us understand where was the controversy?
I think the controversy really came down to people still holding on to that one image of birth that you spoke about already, in terms of, you know, seeing women screaming. And the way I picture it is you've got, you know, a woman laying on her back on a hospital bed or semi-seated, and there's people yelling at her and she's screaming and everything's chaos. And that's really why I did this, because I wanted people to see that birth doesn't have to look anything like that. You know, like an undisturbed natural birth, I've been to many and none of them look